All right, welcome everyone. Thank you for joining us on a Tuesday night. Your time will be very well spent because we have a world-renowned gait analyst and all-around amazing guy, Dr. Doug Adams. He is going to talk to us about, I think, one of the most important, but also in some ways, the most complicated and complex things that we measure, and that's gait. And he'll give us pearls and pitfalls about how to make sure we do that correctly and a lot of insights, and you're going to enjoy your time a lot. So, Doug, without any further ado, the floor is yours.
All right, too kind. Every time we do a webinar or talk together, I always think you have a second career in like radio, Ben, where you could do intros and things like that, especially the beard. But thank you all for being here tonight. This is something I'm really passionate about and love to share that passion. And as somebody, I know a lot of people have a residency affiliation. Residency was a huge part of my career, and that was something that really launched me off. And I was so fortunate to have people that showed me the way and feel very grateful and appreciative that I have a chance to help you guys and hopefully encourage you to look at Gait a little bit more. So thanks for attending tonight here. Uh, Doug Adams here, and I am founder and CEO of Run DNA. And I also have two cash-based clinics. I'm based out of Wilmington, Delaware. You may have heard of some of our education about our certified running and walking gait analyst courses, but I also spent a lot of time working in the professional sports world, specifically as a team PT for Tin Man Elite, and now spend a little bit more time on the Department of Defense and Air Force side, really working to help solve some injuries there as well. But been a PT. It's been a while now, but enjoyed the career and the profession, and this is a really great niche that I've been grateful to have in my profession. So, the company Run DNA, we have a mission called 100 Happy Healthy, and this means that we want people to live to be 100 years old, but happy and healthy when they get there. And we take a very movement-based approach to this so that people can get most out of the activities that we love. And the specific thing that we do is we provide education and technology to make that more feasible. So we basically make gait analysis easier for clinicians to provide, more valuable for the people getting it, and also beneficial for the businesses offering it. That's kind of what we do here. Now, as Ben said here, gait, I don't want to allude, make people think that gait is easy. It's actually pretty hard. Gait has a lot that goes into it, but there is so much beauty in gait, and it's probably one of the most functional things that people do. And while our company name is Run DNA, I just want to clarify kind of at the beginning here, we're talking about walking and running gait because athletes also need to check out their walking and pretty much everyone else walks too. So gait is an essential part of what we do, and it's probably the most it's probably one of the ways that you can really identify somebody's movement capabilities in a most functional way. So when we talk about being a great gait provider here, there's really a foundation of a couple different elements. And this is something that we talk a lot about in our courses, especially our live courses here. But we talk about the corners of the pyramid are really having a solid understanding of biomechanics, the a knowledge of movement capabilities, but also the skill to assess biomechanics and movement capabilities, and then a skill of gait retraining. And at the center of this is something that is a little soapbox of mine. We spend a lot of time talking about exercises and what to do for specific injuries or things like that, but we don't spend enough time talking about how to be good at coaching people how to move and talking about our skill set of teaching movement patterns. And that is really at the center of what we do too. And that's what we spend a lot of time in our live courses talking a lot about in there. So to exemplify this, I like a lot of audience participation. So I'm going to ask people to participate. I'm putting up some videos here. And what I want you to do is in the chat, I want you guys to start putting what you see. So I'm going to give you guys a second here. We got a national level high school runner, one of the top in the country, came to us for some gait and some physical therapy. And I want you to look at these videos and just start putting in the comments some things that you see that you might want to address or look at with it. So let's go ahead, I'm going to give you a second here, and I want people to participate. Ben, I can't see the comments in here, so I'm gonna let me see if
Yeah, I've
I
got it. If you just go in the
yeah
anyone who goes in the chat, feel free to start typing. I can
yeah
see it, and I'm happy to feed it to
yeah.
you if you need it.
Okay, I'm gonna go back into the presentation there, so you guys don't have to see all my messy tabs in. But
So we got calcaneal inversion of the right ankle is
yeah,
one comment that popped through.
good. Okay,
Thank you for being brave. Keep it coming, guys.
keep it coming. Yeah, we like participation here.
Next comment is overstriding. I got a little to no heel strike. I got a knee valgus,
Yeah,
slight knee valgus on the right, landing flat on her foot instead of on her heel. Left hip drop. I got another one that right hip drop.
there you go.
Thank you guys. Keep it coming.
Good. All right. So keep those coming and keep putting that in here. Take another, I'm just going to give you another 10, 15 seconds to look at them. We're going to keep going on. But we're going to come back to this video later. And we're going to see how, with some of these cheat codes we're talking about, how do we make this a little easier to assess? How do we make this something that can be easily part of our practice? So keep putting some things in the notes, and I'm going to keep going on with some of the talk here. But I also want you to think, how many of you, and I'd be curious here, so more participation, you can raise your hand or put it in the comments as well if you didn't want to comment on that. A lot of people are probably using a goniometer or a dynamometer to measure strength, to measure motion. How many people are doing objective gait analysis? I think our profession has really done a great job of looking for objectivity, of saying, hey, yes, we need to show our work. We need to show what we're doing. We're going to measure. We're not just going to guess. We move beyond manual muscle testing and doing some of those things. And now we're saying, well, we want to measure these things. We want some data to show that we're working. But how many people are using a tool that gives them objective measures for gait? And I think there's probably I'm just going to venture to say that a lot less people are measuring gait objectively than they are measuring strength or range of motion. But we're the movement experts. We focus on function, and gait is one of the most functional things that we do. And if we are not looking at that, we are really not providing the full level of care and service that our clients really need. And I don't say that to offend people. I say that to challenge you and say, how can you get some objective numbers around gait? Because I want to see everyone getting the great client outcomes that I know the people taking our courses, the people in our clinics, that they are really able to get and get a whole new level of outcomes based on getting objective data around gait there. So that's what we really want to even talk a little bit about today here. We want to talk about the role of gait analysis in optimizing patient client outcomes. We're going to present a systematic approach to how we can personalize this and find effective gait interventions, and then talk about where to get started. What's the right technology for you, where you're at, how can you just get started with wherever you are for all different budgets, all different levels of interest in this. But hopefully by the end, I want everyone saying, I really need to look at gait. I feel that gait should be synonymous with your blood pressure or your cholesterol levels. It should just be a function of health that people know about and have an objective idea of how well they are moving. So that's kind of my soapbox and a little bit of our mission here at Run DNA is making that a reality. So when we talk about cheat codes, the topic of what we're going in here, there's a couple different things. Like if you're thinking video games and cheat codes, what does a cheat code do in a video game? It's also going to help you skip levels or help you advance faster or give you some special capabilities. So I think the cheat codes really come with Gait of how do we simplify it? How do we personalize it? And how do we prioritize it? And that's what we want to present a little bit here. Now, I'm going to take content from about 19 hours worth of coursework and give us a real quick overview now. So I'm going to go fast over it just to give you a little preview so that you can see what that's like. When we start talking about this systematic approach, we have to really start by understanding, why do injuries happen? And this is specifically from some running related literature, but they said that I love this definition that Bertelsen said, we hypothesize that injuries occurred as a result of the runner possessing multiple risk factors and then participating in running under circumstances to a degree where the structure's load capacity was exceeded. My most wordy slide, but an important one, where it says basically the ability to absorb the forces was lower than the forces acting on the body, and that's why they got injured. And this was not just at the one run, but it's a cumulative effect over time. And the solution to this is figuring out for each person, where's the breakdown in the chain? What is happening that is limiting their ability to absorb those forces, or what's contributing to higher forces acting on the body? And we need to personalize these programs, and they have to be tailored to the individual, looking at them as a whole. I am a big Gait person with this, but Gait is not the only part of it. We're going to present our 5 categories of running gait impairments, but we also have other things like the runner readiness assessment, which we see a little preview over here. We have our loading levels. We have our gait capacity screen. We have lots of different ways to look at some of those movement capabilities that are an essential piece of the puzzle. And as a gait provider, we need to be able to create a storyline around how these things interact. And then we need to be able to pick the point that we want to storm the beach and make our biggest effect on what we're looking to do. So right now, let's go into one of the categories that we probably see most. And I heard somebody in the comments saying that video, the 2D video was shown, was overstriding. So that's our first and probably most common gait impairment that we see in our first of the categories. We're going to see that the person's going to land here too far in front of the body. And we're going to see that if we can quantify this person is landing 32 centimeters on the right and 29 centimeters on the left. So it could be too far or asymmetrical, and that is going to be a force issue. We're going to see high forces, braking specifically, that's going to slow you down and put a lot of stress on different areas of the body here. We measure this and we look at, to try to get clues about this, we're going to look at the angle of the shin, the angle of the foot, the distance from the center of mass, and we're going to be able to look at this. And this is something that from a sagittal plane, we're able to get some good data even with 2D and be able to see that and be able to identify this. So now the question is, and because we want to cover a lot here, I'm not going to have people answer this, but as you're looking at these cues or these categories, think about what cue would you use? How would you fix somebody? If you identify an overstrider in your clinic, what are you going to do for that person? So examples of cues we use, we might teach somebody how to drive their knee. We've had people talk about cadence as a way to address this. We've talked about cues of getting your foot off the ground quicker. In our level 2 course, we're going to give you a lot more ideas of this and talk about the 4 types of overstriders. But as we're going through these, think about ways of how you not only identify these, but how are you going to fix it and be able to quantify a significant, meaningful change in that. Our next category is the collapser, and this is probably our second most common one that we see. And this is somebody people definitely know. You are losing the frontal and transverse plane battle. So from the side, as we look at this here, we can definitely see, hey, yeah, that person doesn't look bad. But then we go to the front and kind of say, woof, that looks like it hurts there. So it's going to be mostly in that frontal and transverse plane. And it is a multi-segment involvement here. We're going to see it can happen at the foot, at the knee, at the hip, at the pelvis, at the lumbar spine, thoracic. We're going to see a lot of areas contributing to this collapsing. Typically, we're going to see hip adduction, hip internal rotation, contralateral pelvic drop, and pronation be some of the key variables that we're looking at. So if you see somebody that has that, one or all of those, you might want to address some of those things. But we also, this is a really good one to talk about the need to incorporate movement capabilities in the whole picture, because what's some of the first things, you can just say it to yourself or say it out loud if you're around somebody. When you see a collapser, what's your first thought about this person? What are you going to make a judgment about? I'm guessing a lot of people are probably saying weak hips, right? Weak core, weak hips. But what if this person has significantly limited ankle dorsiflexion? And the only way that they can absorb some of those forces is by pronating or externally rotating that foot, because they can't dorsiflex the ankle. And then the knee collapses inward, and we're seeing hip adduction and pronation, not because of a weakness, but because of a mobility restriction. So that's something that we really can't judge. And these categories are a way just to help us to communicate some of the mechanics that we're seeing. When we did the little experiment at the beginning where people started throwing out, hey, I see pelvic drop, or I see knee valgus, or I see ankle pronation, those are really helpful. But being able to say, this person's collapsing, this person's overstriding, that gives us a lot better communication and a lot better idea of where to start, instead of trying to focus on all the different things that we can see there. So some cues we might use for this, we might say, hey, imagine there's a flashlight on your knee. Make sure that it points forward. Or I'll have people do some crazy cues where they start putting their hands out and pretend that they're running and like a Charlie's Angel and pointing a gun in front of them. Because if we take the arms out of it, they have much less counterbalance from the rotation of the arms, and they have to really pay attention to what's going on in the lower body. So there's lots of different cues. There's 6 or 7 of these cues that we really use for collapsers too, that make a big difference. The next category is the bouncer, and this is somebody that has high vertical oscillation. So the difference in their maximum height and minimal height is going to be higher than we would like. With our 3D software, which we use for teaching method, we're seeing 10 centimeters or greater is something that we are going to notice with this. You'll also see that they have a low forward lean angle, and there's often hip mobility restrictions that limit their extension, which changes their angle of trajectory when they take off. So somebody here that's running a lot of up and down, 12 centimeters with the video here, that's excessive, and we see what goes up must come down. So higher forces. When we look at this, this is something that we can give cues to run low to the ground. We can say, imagine that you're running under a bridge. This doesn't work for bald people like me, but if you got hair and you got a ponytail, say, don't let your ponytail bounce up and down too much. Give them some type of external cue. And we spend a lot of time talking about cues and things as we go in these courses. Now, the next category is the weaver, and this is person with a narrow base of support. And this person, if they were running down the road, they would be crisscrossing over the line as they're running down the road. And that's the same kind of thing as a cue you can give. Run down the road, let one foot touch and let one foot not touch. You want to make sure you're using the white lines and not the yellow lines so they don't get hit by a car. But giving them some type of external feedback lets them know if they are staying in a wider base of support. This one's a good one to show how you can really be a hero to somebody like this that comes in and you identify this category. Think about to yourself, what tissue would be affected with a narrow base of support? We might see that somebody with IT band friction syndrome might actually have a narrow base of support, and this is putting the structure on stretch. And by teaching them how to run with a wider stance there, or step width there, we are often able to see an immediate reduction in some of those symptoms. That's how you can use this information to really be a hero to these runners, to get them to reduce some of their pain and let them participate, because runners definitely don't like being told not to run. So having some tools in your toolbox to help them stay running without causing more injury is a great way to gain their trust. Finally, the last category here is we've got the glute amnesiac. This is, I'm old and I'm going to date myself with this reference, but Weekend at Bernie's, kind of leaning back, taking their butt for a run here. We see that they have a low forward lean angle. And this gives a mechanical advantage to the glutes to not work as hard, but it puts increased stress on the front of the knee. So somebody that's having anterior knee pain with a low lean angle, if you can cue them to imagine they're running uphill, which we say the lean should come from their ankles rather than from their hips. If you can teach them how to do that, they're going to love you, because their knee pain is going to significantly reduce, if not go away, because you're reducing that moment arm and the stress on the anterior part of the knee. So these are our 5 categories for running. We have the same type of categories, and we don't have time to go through all of these now because I want to make sure we have some time for questions at the end about gait analysis, gait retraining. But we also have the same types of categories. We've got 7 categories for walking, and these are based off of the mechanics. I started very much in the running world, but have grown to really love walking and see how the walking analysis actually has a really big impact for our athletes too. I have started looking at this. If you're doing post-op ACL, if you're doing non-op, even somebody with low back pain, if you're not looking at their walking, you are likely missing a big piece of the puzzle of how to get them better results. So understanding these biomechanics, the kinetics of what's happening on the body, those things are all extremely important for your understanding of how to get these patients better outcomes, and being able to master these things. That these are just some of the slides from the courses that we've got, to understand where are those forces happening, what are they, what's the expected normative values at each phase of gait, and how can we express that and understand where those things go wrong so that we can have a better idea of how to make better outcomes for our clients here. And each of these programs that we talked about for the running and for the walking, they all have specific gait retraining and corrective exercises so that you have a starting point to understand how to make the biggest difference. And we've taken those from years and thousands of examples of runners and walkers of how to get them improvement. So it's also not just about analyzing, it's also about assessing. So now at this point, we've kind of said, all right, we've simplified gait. Now let's talk a little bit about personalizing gait retraining and how to focus on our top priority with that. The good news with this is that a little bit goes a long way. And we are not trying to have people run perfectly, because no such thing really exists, or walk perfectly. We want people to be able to just see a little bit of improvement, because we really see, it's the literature supports this. We actually found another article that actually shows the same type of thing, that if you can reduce the stress of each step by 10%, somebody can run twice as far before the body breaks down. 10%. That is really easy to do, 10% with somebody. The trick is, what's my 10%? What's your 10%? What's Ben's 10%? We need each of us to figure that out and personalize it, because there are unintended consequences a lot of times of some of these gait retraining. We have to understand, hey, if I am having that glute amnesiac go from a backward lean to a forward lean, where am I shifting some of the load? That person, if they're having some Achilles issues too, that might put some additional strain on that. And we need to make sure that we're preparing the tissue. So we don't need to make people perfect, but we do need to find what's the easy button for them to make it a little bit better so that they can participate a great deal better. So in our level 2 course, we do talk about those 12 categories, and we talked about those 4 different types of overstriders, 3 different types of collapsers. Each one of these, there's a little prioritization for those, saying that overstriding we often want to address first because they're high forces. And with those categories, an important thing to know is people rarely fit into just one. They're often, I probably fit into all 5 in some way or another there. But if I address my top priority of overstriding, the collapsing goes down significantly. My part of my cueing for addressing the overstriding is getting a little bit more of a forward lean, so the glute amnesiac starts to go away. It's not that we have to address all of them at once. We have to pick our top priority and figure out what's going to get us the most benefit, the most bang for our buck. So this is something that we just revamped our live skills lab course, and this is something that we teach a bit here. So on the right is just for learning purposes here. We're using our new 3D dashboard of what a 3D gait analysis looks like and all the information that we can get. And we're going to talk about how to choose the right gait retraining intervention for somebody. So our first category first priority is looking at the category and seeing where that is, because that is the biggest, broadest overview of looking at all the different variables involved and prioritizes what is likely to get us our most benefit. The next thing we're going to look at is how are we grouping things. So this can be done with 2D as well. You don't have to have the 3D software, but if you're looking at somebody run saying like, yeah, I saw like three things wrong at the knee, but I only saw like one, the pelvis looked pretty good, hips maybe a little tight. What are we seeing from a general overview here? And then we're also then going to start looking at some of the individual things that have a bigger variation. Our software is going to tell you the primary factor for why their score is higher than it should be. But we need to understand what that looks like and understand some of those normative values like we're showing. And then we can start to pick and say, a more practical example of this is saying, all right, I've got an overstrider right now, and I see that their shin angle is very aggressive. Instead of being nice and vertical, it had a pretty aggressive angle here. I'm going to address that first and see how that helps. And then you give a cue that you know will have an impact on that. So driving the knee, by focusing on driving the knee forward, not up, we're going to have the knee stay in front of the foot so that they never get into that aggressive shin angle there. So this is part of the things for our Helix 3D users and for our education courses. We teach a lot about selecting the right cue based off of the impairments that you see and how each cue has a specific impact on certain biomechanical features that we've noticed. And we're lucky enough to have thousands upon thousands of examples of this to know what really works and what doesn't there. Now, gait retraining isn't just the cues that we give. We also need to really incorporate drills into it. Drills are a huge aspect. With the gait retraining that we do, the goal of it is for somebody to feel the different posture or different movement pattern that we would like for them. So this is an example of one of my favorite drills, the marching drill. It really teaches people that appropriate knee drive, and it's a great one to do. We need to do skill acquisition the same way you would any other sport. We do drills for basketball. We do drills for baseball. Why are we not doing drills for running? And it's going to help people really acknowledge and realize some of the benefits of that and get a little bit of a taste of it. Because what we know is we can't just strengthen somebody and expect their form to change. When we talked about that collapser that we said might have weak hips, there's plenty of studies like the one we have up here by Rich Willey and Irene Davis showing that you can strengthen somebody's hips and they'll get stronger, but it has zero impact on their actual movement patterns. And that's a really important point. You are increasing their ability to absorb some of the forces. So you might be like, well, I've helped runners before and I strengthened their hips and they were able to run better for a certain amount of time until that cumulative load piles up again and then they're injured. So we need to focus on skill training that results in a cortical reorganization that strengthening does not. And we really need to focus on drills and gait retraining to get the results that we're looking for. It's all part of this unique injury profile that every runner has. We have to look at their movement capabilities, their form, their well-being, training load, the shoes and equipment and environment, their unique experience, their running age, all of those things pile up into a profile of a runner that's in front of you. And what we're just trying to convey here is that the running form is a really important piece of that a lot of people are not really considering, but it is a critical piece of the puzzle there. So hopefully everyone's really jazzed about doing gait analysis now and is going to start. So I wanted to jump into a couple of just tips and tricks and again some of those cheat codes so that you have an idea of how you can start analyzing gait. Probably a couple more, 3 to 5 more minutes of just some tips here, and then we're going to open it up for questions if you want to start thinking about some of your questions here. So a lot of you, I assume, are probably doing 2D. And that's a great place to start. And it's really something that you can do. So we put together this just as a way to give you some ideas of how to get the most out of it. If you're doing 2D, we want to make sure that you're using the right equipment, at least doing 60 frames per second. And you want to make sure that you're perpendicular and getting the whole body with this. you should be about 4 to 6 feet of space behind the treadmill. We'll be able to get from head to toe there. From the side, you might need to get 8 to 12 feet away. So you do need a little bit of space, and a low profile treadmill makes a big difference. Getting them in tight fitting clothes is going to help you to better visualize it. And even placing markers on will help you with accuracy. I'm not a big fan of drawing angles with 2D. I think it's can be misleading, and misinformation is worse than no information. But if we can get multiple views from both sides and the back, and using repeatability like tripods and things like that, it will really help with the quality to give you some subjective ideas of maybe what category that person in or what could be contributing to that. Um, Again, if you're looking at 2D, here's our runner from earlier. I just want to tell you that anyone can find a particularly good or particularly bad stride on somebody because there is variance in gait. You should be looking at a minimum of 5 frames because of that variance. So if you're doing a gait analysis from both sides and the back, and you're looking at initial contact, mid stance, terminal stance, and swing, you should be looking at least 60 frames. And that's why we see that on average, a good 2D gait analysis takes about 32 minutes. And that's what they found in some of these studies here. So if you're doing this and you don't have 32 minutes, I would prioritize looking at sagittal view, and I would look at subjective versus objective. In my opinion, drawing lines is not going to give you a lot of benefit. I think you could look and say, hey, it looks like your foot is landing in front of your knee, a little bit of overstriding, or you could say your knees are close together, or it looks like you're leaning to the side. Those types of subjective things are going to give you a little bit more speed and are not going to overstate some of what you can do with the 2D, but it can still be very valuable to educate the runner, and this is for running or walking. It can still be really valuable just to get some objectivity, to be able to slow it down 60 frames per second at least, and really looking at some of those variables. So now we're looking at this again here, and we kind of said, tell me what you see. And hopefully, if you're looking at this again, now you can say, hey, what do you think? Is this person an overstrider? Are they a collapser? Are they a bouncer? Are they a weaver, a glute amnesiac? What would we do with this person too? Versus, with a 3D, where tell me what you know a little bit here, that this person was an overstrider collapser. They had a 2 centimeter higher strike from center of mass, 8-degree higher pronation, and 6-degree higher contralateral pelvic drop, all on the symptomatic side. So the overstriding was contributing to higher forces and led to some of these collapsing mechanics that some of you were picking up and seeing some of those things. But in less than 5 minutes, we were able to get all this data and really start focusing on the gait retraining and being able to know exactly what we're doing there with that. So if you're looking at this, if you're considering doing objective, I highly encourage you to at least slow it down. If you're considering adding 3D, it's never been more affordable or practical to do. Look at factors like we have here: reliability, accuracy, the time to perform, portability, ability to use it for gait retraining, reports. Price is a very important one, and marketability. But you have to look at different things and consider what's important to you, right? Not everyone is going to use 3D. Our goal as a company is to get everyone doing gait analysis. Not everyone is going to do 3D. We acknowledge that, and we really want people to consider their clinical considerations. Do I have the right patient population for this? What's our clinic space look like? What kind of data do I really need to get out of this? Are we looking to make this a standalone service, or are we looking to use this with more of our patients? Do we see that we can get a financial return on investment? Is this going to help us attract or retain staff who are looking to use technology? These are all different factors that you consider when you're looking for the right technology for you. If anyone is interested in technology, this isn't meant to be a promotion, more of an education event, but give us a call, sales@RunDNA. We can do a little analysis with you to see if it's a good fit for that. And if you're also interested in learning more about the courses, We did provide, we know resident salaries aren't always the highest. So we wanted to provide a discount code for anybody to get 30% off through the end of the month. If you're looking to get more education about this, you can email us questions at education@rundna.com or use this code at checkout and just head over to rundna.com and check that out. So I will pause now and see if anyone has any questions or thoughts, and I'll stop sharing my screen so that I can see some of those questions or comments. You're welcome to put them in there or raise your hand. We got the chat going. We got couple questions popping in, so we'll go through those. If you need to drop off, I really appreciate you showing up tonight, and look forward. And my email is doug@rundna.com. If you're passionate about this and looking for more ways to get involved with it, I'd love to chat with people as well. So all right, so we got our first question here. How would you go about improving gait dynamics in a patient with a more rigid deformity like knock knees or bow-legged deformities? Right. Great question, Ben. Right. There are sometimes things that we need to consider. Somebody has a fused ankle joint. Somebody has something. I would say, you really want to consider the whole picture, and posture is a big part of that. So you might want to understand, hey, that person with if they're truly tibial varum, okay, I'm not going to see a lot of adduction with that person. So how do I address that? That person, if you notice that they're overstriding and they're not able to absorb some of those forces by the natural movement, not all hip adduction internal rotation is bad. We want a little bit to absorb some of those things. That person, you really need to focus on some of the other ones to say, I need to reduce their overstriding, or I need to make sure that their lean angle is right so I can make the loads manageable, because they're at a little bit of a disadvantage because they're not going to be able to absorb the forces the same way somebody else might. So you have to kind of think about back to that unique runner injury profile and say, where can I make some gains and how can I make those loads lower? Or can I shift them to a structure that's a little bit better with that? So good question. With that, you have to consider, is it truly a fixed deformity? Can we address it? Can we fix it or not? But if you can, then by all means. If you can't, then think about ways to get around it there.
Doug, I'm going to interject there as well,
Yeah.
and just say you brought up a really good point earlier, which is you got to get 10% somewhere.
Yes.
And the obvious thing that you see there is the skeletal fixed deformity. And that's immediately what your eye is drawn to. But you pick up 10% somewhere else, you still give them that same benefit. So even if you can't change that factor, with more education and more robust tools, you can pick up all those other things that you can get that 10% somewhere else.
Yes, great point there. So, all right, Tyler has a question next. He said, you mentioned that environment does matter, seeing as the vast majority of those runners are not performing on a treadmill. Do you ever see discrepancies between their form on the treadmill versus on a track or cross-country trail? Yeah, great question. The benefit of doing a treadmill-based gait analysis is that you're going to be able to see more strides, right? Looking at somebody outside, IMU-based analysis is pretty limited in its abilities to look at kinematics. So even though you can run outside and get more of a true environment, you're not going to get nearly the quality of data from an IMU-based one. So on a treadmill, what we notice a difference here is that we have seen literature that shows that they tend to run with a slightly higher cadence, and that they're more likely to land in a more mid-foot to forefoot position. So if that's almost an advantage in my mind of doing a treadmill analysis, because if you see somebody with low cadence, or if you see them with a overstriding or a heavy heel strike kind of position, that is going to probably be worse on the road. Now, what we do is when I do a gait retraining program, because I see our next one is a return to run question. So I'll answer a little bit of that almost with the same one. When I do a gait retraining program, I do start them on the treadmill because we don't want to manipulate too many variables. And if you are having somebody doing gait retraining, if they're manipulating their speed as the same time as we're changing some of their gait mechanics, we might see too much variability. So the treadmill is a really great tool. And if somebody hates the treadmill, that's fine. Just have them do their first couple minutes on the treadmill and then go outside. But when I get to the third or fourth level of a gait retraining program and I see that they're consistently performing the new movement pattern that I've asked them to do, I transition them outside, but I step back a level. So if they're on level 4, running 4 minutes of running and 1 minute of walking and doing that 6 or 7 times, I'll step back and say, all right, let's go back to 3 minutes of running and 1 minute of walking, because they might pick up the speed a little bit and the forces might be a little higher and it might be harder for them to do. So when I transition from the treadmill back to the road, I go back down a level in the return to run progression to avoid them overtraining a bit or experiencing higher load issues. So that's something I have seen be very helpful to avoid that. It was great, but then I started developing calf pain because they started running outside and they started running a little faster than they were where the treadmill was controlling their speed. So, very good question about that. Yep. Next question from Cole. When you're doing return to run with someone, oops, we got a couple questions. Sorry, scroll down here. Who had someone running completely due to their injury, how do you determine what their starting mileage should be? Who had some running completely, who had to stop. Maybe I think that maybe that should say who had to stop completely due to their injury. How do you determine what their training mileage should be? I think Cole, feel free to if I'm interpreting that question wrong, let me know. But yeah, the when we show that pyramid and the coaching is in the center of that, there's a double meaning to the word coaching there. Not only are how we teaching movement patterns, but do we understand the demands of the sport and how training load is impacted? Training load accounts for 60% of running injuries, where people are just running too fast, frequently, without enough recovery. And when we are returning somebody that had to stop completely, it's we have in our endurance course, we use something called the acute to chronic workload ratios, where we look what they've been doing for the past 4 weeks and then try to plan out their next 7 days. Now, if they've been off for longer than 4 weeks, you kind of have to pick a starting point, and a lot of this is going to be based off of their running age. So, have they been running for a year or two? Have they been running for 10 years or so? Are they running 100 miles a week, ultra marathoner, or are they running 10 miles a week? But basically, you're going to use the soreness rules to help you out with this. If they are sore for longer than 24 hours after a run, then that was probably a little too much, and you should either hold the progression or back down a little bit until they can adjust to the volume with that. But it's a little bit of trial and error, finding that right amount. But I often, because of the principles that go into the acute to chronic workload ratios, my first 4 weeks of returning them to running, I am holding them back from progressing once we found a good starting point. So that's something that you just want to consider. It's not just what they did last week, it's what they did over the last month that's going to consider how quickly you can progress them in their running mileage. Cole, let me know if that wasn't what you were asking. All right, John was asking, how do you prioritize which biomechanical findings to address when first training an injured runner? That's where we really go into those categories, and we really look at ones. We have to look at which ones are contributing most to the mechanics, most to the injuries that could be related to their injury that they're coming in for. But a lot of times we're going to prioritize that overstrider first and try to reduce some of the stress on the body. Then we're going to look at the collapsing, because the collapsing might not be as high force, but we're putting the forces in the wrong place. Then we're going to look at some of the other categories like bouncer, weaver, glute amnesiac for the same thing, but try to relate it back to what their injury is, what are their movement capabilities, and how to prioritize it. But the thing is people don't believe it, and this is why I say gait is hard, but it doesn't have to always be. One of my favorite things to do with a runner is when I do their gait retraining, I ask them to go back to their old form immediately after I give them the cue. And the look on their face is like shock and awe. No way. I'm never running that way again. And that is possible to do. And when you get that, you know that you found a really good result. When you first start, you're not going to get that on the first time. It's going to take a little bit to learn. That's why we put these courses together to help people get there quicker. But it's an important factor to find that, subjectively, or do they feel different with it? Objectively, are we noticing improvement in the biomechanics? Good. All right. Mike was asking, you mentioned preparing someone for the change that you're about to introduce to their gait or running form. How far ahead of introducing change would you start the prep work? Yeah, that's a great question too. And this is something that when my early career was a lot of ACLs, and I did some publishing guidelines and did a lot on that. And one of the things that I was a big soapbox on was that we need to prepare people for running far before they're actually running. We should be doing drills like the marching drill, the wall drill, doing those drills and preparing their body for the stresses and for the movement patterns. There's no reason you can't start those way earlier than when they're cleared to run. I think that we should be doing those early and often when we're in that stage, assuming that you've controlled things like anterior knee pain or some of the other factors or whatever injury they're for, not just post-op ACL, but any operative or non-operative that has not been able to run. Getting them, if you're controlling and making good progress on some of their movement capabilities, we should be introducing those drills early and often. It's not to preclude them to say like, hey, if you didn't do 3 weeks of drills, I'm not going to run with you. But I am going to just be cautious, to go back to the question before about how quickly I'm introducing mileage as we go with it. But it is very important also from a strength training perspective. We didn't even get to go on one of my biggest soapboxes about strength training in runners, how important that is. So that's really important as well. All right. Let's see. Benjamin was asking, can this type of equipment also be used to analyze jumping and landing mechanics for athletes playing jump heavy sports? Yeah, there's lots of different technologies that look at those different things. We use a more prescriptive analysis that's just the loading levels for that, and it's more where to start with plyometric type activity. But yes, there are ways based off of your space and your budget and things like that, that 3D cameras are able to assess jumping. They do like landing error scoring system. They can judge that automatically for you, which is really cool. So there are additional things for people doing different sports there. Kurt, hey Kurt, how are you? How closely do you look at forefoot versus rear foot biomechanics, balancing nuances of foot mechanics versus big joint? So my stance on this, I doubt Irene Davis is on here, but I'm going to say earmuffs if she is here, because she was one of my mentors and a brilliant lady. But everyone's got their differences on it. I care less about what part of the foot hits the ground first and more where the foot lands in relationship to the body. So Irene, you can take your earmuffs off now if you're on. But I really feel that we have to allow our body to adapt to some of its natural movement capabilities, but we know that it's physics, right? Moment arms. The closer you're landing to your body, the less forces will be acting on it. That's not necessarily anything revolutionary, right? But that being said, the closer you land to your body, the harder it is to land on anything but mid to forefoot. And I will, and of course, sometimes do this. I will say, everyone stand up and jog in place. Okay, where are you landing? You're landing on your midfoot to your forefoot. Everyone jog in place on your heels. Don't do this if you have an injury, right? Because it's jarring. Your teeth will knock out of your head, basically. So the closer you land to your body, the better. But I'm not going to force anybody to land on forefoot or rear foot. I am just going to make sure that they're landing as close underneath of their center of mass as possible. All right. Tyler was asking, are there any gait drills that you would recommend to everyone? Yes. Sort of a one-size-fits-all treatment that may be effective regardless of the classification. The wall drill. We've got some examples of this on the Run DNA YouTube channel. So if you head over there and check that out, the wall drill, do a little experiment. If you, it's like where you're leaning against a wall in an angle position and you're kind of like driving your knee up and it's having you go through different movement patterns there. That is one drill that no matter what category they're in, you can teach them how to improve their form. Because running is challenging because it's a continuous activity as opposed to something like golf or baseball, which is a discrete activity. And what that means is there's a definitive start and end to a golf swing. We go from one cycle to the next in running. So we can't slow down and say, like with a golf swing, you can just say, like, all right, just go to the back swing. All right, let's get your elbow position right. We can't do that with running. That's where we require drills like the wall drill to slow it down and give them a positional sense of what their body is doing and still putting it in a sport specific position. So the wall drill is probably that one size fits all, regardless of classification, that I would have everyone do. Good question, Tyler. All right. Eric was asking how often you see runners who report symptoms deep into the runs or race, say 8+ miles, and how can you account for that in exam or gait analysis? Great. Just got this question the other day too with one of our customers. And what they are doing in the first mile is causing their pain in the 8th mile. And that is what we often see. Now, what we've noticed, and I've done literally thousands of gait analysis at this point, is the mechanics do change at that 8 mile point. We are going to see some of the mechanics, but what happens is the mechanics change, but it's the same pattern. They just get more of the same. So somebody that's got 10 degrees of hip adduction at mile 1 might be 14 or 15 at mile 8. But it's the 10 degrees at mile 1 that started breaking the structure down, and they didn't cross the pain threshold until they had enough cumulative load on the body. So there's a benefit of looking at somebody at 8+ miles and looking at them in a fatigue state, but it's not critical or necessary. It can be helpful, especially if you need to convince them of the fact that their running form is similar, but rarely do they change movement patterns completely. They are just exaggerating the movement patterns that we are seeing early on. And I will say, like, you got to warm them up. If you look at them in the first 10 seconds of running, it's going to be a little different. But once they're in that warm up period, the mechanics are pretty consistent. They'll just be more as we go here. All right, we got Michael here. How would you tailor a running program for bigger athletes, such as football players and linemen? Would you address the biomechanics the same way as anyone else? Would you do anything different to the increased forces? Yeah, great question here. This is a really good point, and glad you brought it up, Michael. This is not just for runners. This is for field athletes too. We see that a lot of times, almost every sport involves running, or almost every athlete runs for their sport. And it's important that we understand that these mechanics can be universal. So when you're dealing with somebody that's larger, right, we have to think about, you got a lineman that's pretty big, and if they don't have a lot of hip motion, you definitely have to consider their hip mobility as part of some of these mechanics and what that takes. But I would say a bigger person, it's almost more important to address some of these things because running is 3 to 5 times your body weight. And if you can reduce the stress on this, I mean, think of it this way. I've had this discussion. I've had a lot of NFL players come in, MLB, even NHL players come in, right? And when I say, how much time are you spending even just like jogging off and on the field? Do you think that adds up over the course of a game? If you're running with sloppy mechanics, even just off and on the field, or a soccer player, how much time, I'm kind of going into the sprinting versus normal running debate here, but how much time does a soccer player spend sprinting on a field versus slow jogging? So when we're working with these athletes that might say, hey, I think I should look at my sprinting mechanics. It's hard to change somebody's form at maximum effort. Changing the movement patterns at slower speeds is often easier, but it's also really beneficial and important too, because that person is spending a lot of times just easy jogging, often on the field, often on the court, and that can contribute to some of those cumulative loads. And if they have a little bit better form, maybe in that fourth quarter, they're not as gassed and they're ready to go. And that's going to help them prevent the injuries that happen when they're fatigued. It's going to help them go a little bit faster here. All right, I think we got time for one last question here. We're almost at our hour. Do you often find significant differences in mechanics depending on shoe wear? Yes. Shoe is a whole topic we could go through here. It's definitely, I was talking with people in the shoe industry recently, and we were talking about just how different shoes are now. And what we see is that unfortunately, we can't just say, if you pronate, you need this type of shoe. We see people respond very differently. And this is a different response than I would have probably given you even 5 years ago. The shoe industry has changed a lot. They have changed the way that they manufacture the shoes, the materials in it. So there is a big influence of footwear on their running mechanics. So it is important to look at them. If they're looking at cleats versus spikes versus tennis shoes, there are going to be differences and we should look at them. But a lot of times we will see general improvements in mechanics are beneficial for them across shoes, but the shoes can have an influence of this. This is why, partially, we introduced a scoring system in our 3D gait analysis, because that was a great way to quantify how a shoe has an impact on their form and help people select the right type of shoe. So there is definitely an influence of shoe wear on there. I think you were talking even more specifically of like spikes versus trainers. Those will have a big difference too. So if you can look at them and cue them and just even understand, say somebody might have to wear spikes, right? It's going to be competitive. If they understand how their form changes in those, they can be a little bit more aware of their form so that they're not putting themselves in a bad position. So great questions, everybody. That was awesome. Really good, engaged audience, and really appreciate all the questions there.
And Doug, thank you. Really appreciate your time and your expertise. Again, I don't think it's a small thing that so many people showed up on a Tuesday evening to learn. So thank you all for your engagement. Thank you, Doug, for your expertise. Guys, please stay tuned. I will be sending out this recording tomorrow or the day after. And then end of April, April 29th, we have our next topic. It is neural tension in the throwing athlete with sports Division I fellows in Texas, Brian Duncan and Sean Kennedy. So it should be a great session. Looking forward to that. Doug, thank you again. Good night, everyone, and we'll see you next time.
Thanks, everybody.